Bismillah ar-Rahman ar-Rahim. I'm Dr. Mohibullah Wazir, and the topic is the fascia. Note: fascia is a white sheet made up of white fibrous connective tissue. In the human body, the white fibrous tissue from it in the body is being made up of rope-like structured tendons. From it, ligaments are made. From it, capsule are made. From it, the synovial membrane is being made from this white fibrous tissue. And from this fibrous tissue, the epineurasis is made. And in this way, many other structures. And the today's topic is fascia. So, by definition, fascia is a white sheet made up of fibrous tissue or fibrous connective tissue. It is being divided into number one, the superficial fascia, and number two, the deep fascia, and then you can also include the in other area people, the tendons, the ligaments, the epimysium, the endomysium, the perimysium, and visceral and parietal fascia. These are also the subdivisions, but the commonly described in anatomy is the superficial and deep fascia. Now, what is superficial fascia? To understand the fascia, please, the dissection video of mine at my channel, you must first look this, then it will be very easy for you to understand. Now look, first is the skin, and deep to the skin, everywhere in the body there is a fats. This is called as adipose tissue, or also called as subcutaneous fats. And then also present over here, there are the vessels and nerves that enter into the skin, which are called as cutaneous vessels and nerves. And then when you remove the fats, deep to the fats, you will find a thick white sheet made up of white fibrous connective tissue. This I have demonstrated in the dissection video. And this thick white sheet is then called as the deep fascia. But note, actually now I want to explain what is superficial fascia. The skin is, deep to the skin lies the fats, and the skin is then connected by some fibers, connective tissue fibers, to the underlying deep fascia. While removing skin from the animal, if you look, what you do, you take the skin, and the skin is being connected by fibers. You cut the fibers and you remove the skin like this, while deep over here there will be a wide deep fascia. In this way, the skin is being connected by fiber. The skin is being connected by fibers to the underlying deep fascia. But these fibers which connects the skin to the underlying deep fascia, these are very widely distributed, not very closely distributed. In this way, deep to the skin lies the fats and the fibers that connect the skin to the deep fascia. These subcutaneous fats and the connective fibers connecting the skin to the deep fascia, combinedly we call it as the superficial fascia. Although this does not deserve the name, because by name fascia we mean a sheet which can be cut and which can be restitched again. Well, superficial fascia is not like that, but it is being called as superficial fascia. And lying in the superficial fascia is number one, the subcutaneous fats, and number two, the cutaneous vessels and nerves. In the lower part of the abdomen and the upper part of the thigh, the superficial fascia consists of two layers, the superficial fatty layer and the deep membranous layer. When you remove the skin from this part of the lower part of the abdomen, you will see a thick layer of fats. This is called a superficial fatty layer of superficial fascia. And when you remove the fats, deep to that you will find a thin membrane, and that is called as deep membranous layer of the superficial fascia. Then in some other areas of the superficial fascia, you will see some specific points. For example, in the neck region, present between the skin and the deep fascia, that is in the superficial fascia. So, any structure that lies between the skin and the deep fascia, we call it as that it is lying in the superficial fascia. What is superficial fascia? It is not a sheet, but it is the space between the skin and deep fascia, containing the fats and the connecting fibers. So over here, in this upper the part of the neck, lying between the skin and the fascia, is thin muscles which are called as platysma muscles. Then present over here in the palm of the hand, there is also one muscle that is called as palmaris brevis muscle. And then also present some muscles over here in the ears that is also called as the auricularis anterior and posterior muscles. These muscles, these three types of muscles are present between the skin and the deep fascia, that is in the superficial fascia. Also present over here in the thoracic region between the skin and the deep fascia is the mammary gland or the breast. This is all specification about the superficial fascia. I hope now it is clear to you what is superficial fascia. Thank you very much.